Focal segmental glomerulosclerosis is another cause of nephrotic syndrome, but we don't just want to just list things without trying to give reasons, possible good reasons to why these things are occurring. So you usually call it the FSGS. Okay, so I'm trying to give good explanations to how this can be able to cause nephrotic syndrome. So this is what we have, and this disease condition, it scars the glomeruli. Okay, this impairs the kidney function. So focal segmental glomerulosclerosis causes nephrotic syndrome, and the primary mechanism is what? Scarring. It's making these things becoming so stiff and smaller. You understand? So the blood pressure, repeated blood pressure can cause some cracks. So proteins can leak through it, causing nephrotic syndrome. So pathophysiology, there's segmental sclerosis. So only part of the glomerulus is affected, but the damage is enough to impair infiltration. Segmental, so to say, is not all the glomerulus, but of course, a part of it is affecting. Do you understand? So there's podocyte injury. So podocytes detach or undergo apoptosis, leaving areas of the glomerular basement membrane exposed. Then loss of filtration barrier integrity. So the glomerular basement membrane is becoming having some cracks. So things cannot be able to go through it. So there's proteinuria. So there's loss of protein in urine, progressive damage. The remaining nephrons undergo hyperfiltrations, and the injury keeps worsening, and there's scarring. Okay, and it's going like that. So clinical consequences. The person is losing so much protein. Hypoalbuminemia. So there's loss of protein. There's loss of protein concentration in the blood. So protein levels are crashing. Then, because there's reduced oncotic pressure, there's movement of fluid from the intravascular compartment to the interstitial compartment. So there's now swelling around the eyes, periorbital, swelling the legs, the hands, that's peripheral. You can also have swelling everywhere, that's generalized. So there's hyperlipidemia, and you can try to treat it with steroids like prednisone, but it's resistant. Then progression, there's a high risk of this becoming chronic kidney disease and also reaching end stage renal disease. So unlike microscopy, segmental sclerosis can be seen, but if you use electron microscopy, you now see the damage more. Okay, that's a foot effacement, you see it more.